We'll check back with you. Thank you, Mike. 6:03 right now, moving the Bay Area forward. Today, hundreds of thousands of healthcare workers will see a significant bump in their pay as a new minimum wage goes into effect. Today in the Bay's Ginger Conejero Saab joins us live this morning. And Ginger, the workers have been waiting for this increase now for months.
That's right, Laura. Good morning. SB 525 was actually signed into law last year, and it was originally slated to take effect in June of this year, but it got pushed back to help close a state budget shortfall. Nonetheless, months later, the day is here. More than 325,000 workers will see their hourly pay increase to from $18 to $23 per hour. Another 75,000 workers already making that kind of money will also see their pay go up indirectly as a result. Now, this applies mostly to low-paid medical staff in private facilities, like people who provide dialysis for kidney patients, and workers like janitors and cooks at hospitals and healthcare facilities. A professor at San Francisco State University estimates this new minimum wage will amount to an extra $5,000 to $6,000 per year, which he acknowledges is still not a lot of money here in the Bay Area.
But it's an indication of the depth of the problem that, the wages for some healthcare workers were so low in these, very expensive parts of the the state, where especially accommodation costs have been skyrocketing, that something needed to be done to try to address this issue moving forward, or else we would face, extremely severe shortages and retention problems, which are not good for patient care if you constantly have people having to quit their jobs.
Well, Professor Logan says Los Angeles and Long Beach have already passed a minimum wage for healthcare workers and hasn't seen any evidence of layoffs. Now, you might recall earlier this year, this past April, the state bumped the minimum wage for fast food workers to $20 an hour. Now, the professor suspects states like Washington, New York, and Minnesota might also enact a minimum wage for healthcare workers. And like the professor said, that extra $5,000 to $6,000 may not be a huge bump, but I imagine it'll be a welcome bump for many healthcare workers just trying to make it in the Bay. In Daly City, Ginger Conejero Saab, Today in the Bay.